Hello, everyone. Welcome to this Self-Advocacy series. My name is Raquel. I am an occupational therapist passionate about helping people reach their full potential through everyday advocacy. This is part of an 8-month presentation series focused on learning about self-advocacy and how you can integrate the concepts into your daily life. This month, we will continue our discussion from last month on advocating for yourself in healthcare by looking at some tools and resources available to help you on your self advocacy journey. Let's begin by reviewing your rights during a healthcare visit, as discussed in last month's presentation. You have the right to understand treatment or procedures before allowing or consenting to it. You have the right to ask questions when you don't understand, or ask for the information to be presented in a different way. You have the right to tell your doctor how you feel honestly and openly. And lastly, you have the right to bring a support person or learning aid to an appointment to ensure that you completely and fully understand everything that's happening and that has been said about your health and wellness. Don't forget, knowing and understanding these rights helps you take control of your health and wellness through self advocacy. The first resource we will discuss is the Coverage to Care Guide from the Center for Medicare and Medicaid Services. This guide was built specifically for people with disabilities and focuses on breaking down self advocacy skills in checklist format. This booklet features checklists for scheduling your appointment, before attending your appointment, during your appointment, and after your appointment, as well as a structured sheet to list any questions or concerns you may have throughout. Inside, you can also find a review of your rights in a healthcare setting, as well as resources to reach out to if you feel your rights are being violated. Here is a preview of some of the checklists featured in the booklet. A checklist can help you stay organized and feel less overwhelmed when managing or assisting in managing your healthcare. This resource works best when printed for each healthcare appointment or printed and laminated for easy reuse. Before calling to schedule your appointment or arriving, ensure you have read through and understand the information required to check each box. If you need assistance, make sure to contact a trusted person to review the information and offer assistance as needed. To access this resource and explore it for yourself, visit the link featured below. The second resource we will discuss today is an appointment organizer created by myself during my capstone experience. This resource offers guided questions to help you prepare for your appointment and ensure full understanding of your health information. This guide also works best printed for each appointment or laminated for reuse. The guide is broken down into two sections: before you go and information from your appointment. Fill out the first section before and choose to fill out the second section during or immediately following your appointment to ensure full understanding of what occurred during the appointment, as well as what the next step is for following up or a follow up treatment plan. Here is an image of a full resource, and a link to print can be found below. Before you go, think through who you are going to see and what the reason for the appointment is. Then, using the Think About It guided question and examples, fill in some questions or concerns you would like to bring up during your appointment. During your appointment, be sure all questions are answered about what recommendations are made and why, what follow up needs to occur, and why the new treatment plan or follow up plan is important. A section for other notes and information is placed at the bottom left hand corner for extra information or things to remember. Finally, fill out the self checklist before you leave the appointment to ensure you know and understand all the health information and advice given during the appointment. If there is a box left unchecked, be sure to follow up with your provider or a trusted person so that you feel confident in your health and can become the best self advocate. These resources share similarities, but each cater to separate learning styles and preferences. They can be used individually or together to ensure that you feel confident approaching a healthcare appointment, understanding the information, and know why it's important to continue or change your current plan of care for your well being. All of this helps improve your ability to be a successful self advocate. Reflection. Some questions to think about. Feel free to pause and reflect. Some possible responses will be discussed as a guide, but there are no incorrect answers. Question 1. How could the resources covered today help you advocate for yourself? Why is it important to advocate for your needs in healthcare settings? Finally, will you need assistance using these resources? If the answer is yes, who is a trusted person you could ask? As always, here are a few resources to help you continue your self advocacy education. Stay tuned next month for more on self advocacy. Thanks for listening.